My name is Ed Shuster. I'm an internist and a cardiologist. In 1981, I came from Duke and Johns Hopkins and have been living in Stanford since then. Thank you, Representative Exum, for the opportunity to speak, and my condolences. So let's talk for 3 minutes about preventative medicine. When you're 45 or 50 years old, you go see your doctor, and the doctor says, get a mammogram. That's a good idea. Breast cancer kills 40,000 Americans every year. Your doctor says, get a colonoscopy. That's a good idea. Colon cancer kills 50,000 Americans a year. But your doctor doesn't say, get your heart checked out. Heart disease kills 700,000 Americans every year. 800,000 Americans get a heart attack every year. 20,000 Americans have sudden cardiac death, where all of a sudden they're gone. So we need to screen people for heart disease. And the problem with heart disease is, like with early, you frequently don't get a warning. 1 out of 3 people will get chest pain as a warning. 1 out of 3 heart patients will get a heart attack. And 1 out of 3 heart patients will just fall down and not get up. The checkup doesn't help you, the EKG doesn't help you, even a stress test can miss things. So the question is, what can we do to see if you're building up cholesterol in your arteries and you're at risk for getting a heart attack? And that's called a calcium score, which has been told is the easiest test in the world. You lay down, it takes a couple of minutes, there's no needles, there's no injections, it doesn't cover your head, it goes zip, and we can see if your arteries are clean or if they're stuffed up. Thank you for helping us with the insurance, because the test is pretty inexpensive, $99 to $150, but for many people, $150 is a barrier. So if your score is 0, that means you have no cholesterol in your arteries, and I tell you, get out of here, I'll see you in 5 years, and don't worry about your heart. If your score is 100, 200, 300, 400, then we talk about diet, exercise, no smoking, taking a cholesterol pill, and maybe getting some testing. You can't tell who has heart disease. We just finished a major program in Stanford where we did 250 first responders because they got more heart attacks. And there were some people we were sure would have lousy cholesterol scores, and they were 0. And there were some men and women who looked like they were ready for the Olympics and had a lot of junk in their arteries. So we would like people to get calcium scores to prevent heart attacks and sudden cardiac death. And we'd like to thank Representative Exum again for leading this initiative and for helping us with the insurance. Thank you, everybody.